Assalamualaikum friends. Now we will be talking about the thiazide diuretics. So the first keep it in mind that they are low ceiling diuretics and they have longer duration of action. We studied in our previous video the loop diuretics, and in there we studied that the loop diuretics are high ceiling diuretics and they have shorter duration of action. Especially we studied about furosemide. They are rapidly absorbed through the GIT tract and they are rapidly excreted in urine within 2 to 4 hours. So these two points are in opposite with the loop diuretics. Means the thiazide diuretics are low ceiling diuretics. They have longer duration of action, whereas the loop diuretics are high ceiling diuretics and they have shorter duration of action. One more thing to note is that the loop diuretics excrete calcium. So if they're going to excrete calcium, so they're going to treat hypercalcemia, whereas if you're going to talk about the thiazide, so the thiazide retain calcium, they reabsorb the calcium from the tubular lumen. So if they're going to reabsorb the calcium from tubular lumen, they are used to treat hypercalciuria. So the thiazides are used to treat hypercalciuria, whereas the loop diuretics are used to treat hypercalcemia. So you guys don't have to confuse with the word hypercalcemia or hypercalciuria. Hypercalcemia is the increased calcium level in the blood, whereas hypercalciuria is the increased calcium level in the urine. So once again I'm going to repeat that the thiazides are used to treat or used as a therapeutic in hypercalciuria, because they're going to reabsorb the calcium, whereas the loop diuretics, they are used as therapeutic dose in the hypercalcemia, because they are used to excrete the calcium. Okay, now we have some drugs and you have to remember all those, and it is important that you guys must know the names of the drugs, so that your paper must be effectively done. Okay, so the drugs names are the chlorothiazide, hydrochlorothiazide, hydroflumethiazide, benzoflumethiazide and benzthiazide, whereas the thiazide like diuretics include the chlorthalidone, indapamide, metolazone and zipamide. Okay, now moving onwards, we have its site of action. Where does the thiazide act on? So the thiazide act on the early distal convoluted tubule. Over here they block the sodium chlorine symporter and thus they excrete the sodium, leading to hyponatremia, which is its adverse effect. It also causes hypokalemia. Why? I'm going to discuss that. Okay, what happens, we now we know that the thiazide act on the early distal convoluted tubule over here, right? In early distal convoluted tubule there is the presence of this protein symporter, and what it do, it basically reabsorb the sodium and chlorine. So if thiazide are going to block this symporter, what will happen? The sodium and chlorine will be excreted in urine. The concentration of sodium over here will be increased. So if there is increased concentration of sodium in the distal convoluted tubule, it will be reabsorbed and the potassium will be excreted, right, through growth transporter system. The sodium will reabsorb and the potassium will excrete. So if there is low potassium, means if there is excretion of potassium, it will lead to hypokalemia. So it's in a side effect, as it causes an electrolyte disturbance, it causes hyponatremia, hypokalemia, right? Okay, now we're going to discuss therapeutic uses. So in therapeutic uses, I told that it treat hypercalciuria, means if there is increased calcium level in the urine, they are going to absorb the calcium from the urine and thus treat the hypercalciuria, and I told you that you're not going to confuse with the word hypercalciuria with the hypercalcemia. Okay, now it is understood that it causes hypertension and edema. Why? Because it excrete sodium. When there is excretion of sodium, it is used to treat hypertension. Moreover, if there is decreased volume, it is going to treat hypertension. Edema, we know that whenever there is fluid retention in the interstitial space, so we call that edema. As thiazide excrete more water, so it is used to treat edema. But what happens in diabetes insipidus? Why? Because in diabetes insipidus, we studied that the diabetes insipidus, there is more urination, means there more volume is being a large amount of volume is excreted as urine, maybe because of the nephron inability to respond to the ADH, which is antidiuretic aldosterone, ADH, or maybe because of low excretion of ADH, as ADH is used to absorb the sodium. So how are you gonna say that in diabetes insipidus they are also going to have a large amount of volume excreted in urine, and in thiazide there is also excretion of large amount of urine? So the point over here is that as compared to the excretion of volume in diabetes insipidus, there is lesser volume excretion in the thiazide diuretics. So it prevents the more loss of, or you may say the large amount of volume excreted as water. Okay, so in this way they are going to treat the diabetes insipidus. Okay, now in electrolyte disturbance, we studied that it causes hyponatremia, it causes hypokalemia, and it causes once that it does not causes hypocalcemia. Hypocalcemia is caused by the loop diuretics. Hypocalcemia is when there is low level of calcium in the blood. Rather, it causes hypercalcemia, right? Means because they reabsorb the calcium. Okay, and the metabolic disturbance are same as loop diuretics, means they causes hyperglycemia, means why? Because they decrease insulin secretion. They causes hyperuricemia because they decrease the renal secretion of uric acid, which may precipitate the attack of gout. Or it also causes hyperlipidemia, means it increases plasma triglyceride and low density cholesterol level in the blood. Okay, now it causes impotence. What is impotence? In impotence, the young man has difficulty to achieve erection and orgasm, so it causes an impotence. Therefore, we are not going to give the thiazide diuretics to young men. Okay, moreover, they should not be given in pregnancy. Why? Because they decreases the blood volume. So if the blood volume is decreased, the blood perfusion to the fetus decreases and it may lead to fatal death. So we're not going to give the thiazide to a pregnant woman, right? Okay, they also causes GIT disturbance, which include nausea, vomiting. You all know that it causes skin rashes and photosensitivity. So it was all from my side. Hope you all get the point. Now we will move onwards to our next diuretics. Allah Hafiz for now.